Okay, so we're gonna run through some drills where we can start training hip extension, pelvic stability, so I'm able to still use my hip, get my glutes working, keep those hamstrings working a little bit without putting any load on the foot. So the first variation, I'm just gonna drop that knee down onto the bench, and I'm gonna make sure as I lift my leg up here, I'm gonna make sure I don't dip into the outside of your hip. So if you feel your hip in the center and you feel your glute, your butt back there, you know you're doing good. If you're feeling the outside of your hip and you're feeling this muscle here, you know you're just dumping in. We want to get away from that. So you could do this in front of a mirror and make sure that your knee, hip, chest is in one straight line. I'm using the pole here for a little bit more support, but I'm going to use that as little as possible. So I'm really thinking about squeezing my butt and pushing my knee into the bench. If you want, you can make this a little bit harder. You can add some weight, and that's gonna really work and force you to stabilize as hard as you can here. I can then work on trying to really work on my balance, take that pole away, gently put the foot down when you need to, or just keep the pole there and go back and forth. And the ultimate goal here is that we're working on that hip stability to replace not being able to put weight down on the boot, on the foot. So I still want to be able to use everything here. I still want to be able to use my hip the way a hip is to be used. Next variation. We're going to get a little bit of internal external rotation here. So our abduction and adduction along with the internal external rotation. So now again, my hip is staying nice and strong. I'm really having to work my glute, really feeling the glute. Try to keep your belly button facing forward, keep your chest facing forward. And now we're going to progress to the internal external rotation. So here I'm going to use a weight to the side, but you could use anything. You could use the pole out in front. You can use a bench, table, whatever you have. You're going to stabilize your upper body. Now I'm going to drop my good side, I'm going to drop my left side into the bench as hard as I can, and then I'm going to push that knee into the bench to open up my left side. So I'm getting some nice rotation on that hip. Again, most of the feeling is going to be in your glutes, in your core. And I'm using a lot of support, so I'm really using my hand here on both sides. And I'm gonna push for as many reps as possible. I wouldn't worry about a set amount. Instead, I'd worry about trying to get to failure. A lot of the problems we're gonna be facing with this is not being able to work to failure enough. And that's really what we need to get that blood pumping, get that cell regeneration, to get the hormonal level of recovery going. And ultimately, remember what we're trying to do. Maintain as much function as possible on this side while we don't have access to putting weight on it. So those 3 exercises are a nice little start. They're not too aggressive. You can use them completely non-weight bearing. Just go slow and explore, like have fun with it a little bit. It's going to be nervous. The more nervous you are, the more you're going to hold on to things. I am currently 3 weeks post-injury, full rupture, non-operative. So I'm feeling it out, not putting too much pressure on the foot. Seeing a specialist again next week. He said to go load bearing as much as I can tolerate. I'm being a little bit more conservative. Everybody's going to be on a different protocol. Don't judge yourself off of me or anybody else, but do explore, see what you can expose yourself to. The more blood flow we get to that area, the more muscle we hold on to, the less strength we lose, the better that recovery is going to be down the line.